Good morning, guys. I'm Chad Newell, president of the Area Development Partnership, and welcome to our May Accelerate program. Thank you for spending 1 hour with us this morning on Zoom on this beautiful spring day here in the Pine Belt. We are just elated to have an esteemed group of healthcare practitioners today that comprise our panel, and also very pleased to have Millie Swan, the Chief Marketing Officer at Forrest General Hospital, as our moderator of today's panel. Millie will be introducing our panelists in just a bit. It's very exciting. We'll be discussing the vaccine rollout and how that's going, certainly how things are going with the pandemic, and then a look ahead, hopefully toward a post-pandemic era. And so things are opening back up, but we still have to be mindful of the pandemic and look forward to really just getting some good health expert advice today from our panelists. I do want to thank Forrest General Hospital and Hattiesburg Clinic for sponsoring today's program. Just two huge employers in our area, world-class healthcare providers. Certainly glad that Andy Woodard, the CEO of Forrest Health, is on our board of directors. The CEO of Hattiesburg Clinic, Dr. Bryan Batson, is also on our board of directors. So not only are they providing world-class healthcare services, but they are very engaged in the business community. And so we are very thankful for that. I will remind all of our participants today that we will have a Q&A session at the end, and hopefully we'll have a little time to take questions from the audience. So please log those in to the Q&A section at the bottom of your Zoom panel, and Millie will be glad to go through those and try to take as many of those as we can toward the end of today's program. To get us started off on the right foot today, we are going to have an invocation from Mike Dixon. Mike is the executive director from the Pine Belt Foundation. Mike will be followed by Dr. Bryan Batson of Hattiesburg Clinic to provide some sponsor remarks. And Dr. Batson will then be followed by Alan Anderson, our Chamber of Commerce Division Chair. Appreciate Alan being with us today and thankful for his service on our ADP Executive Committee. Alan will be providing an update on new members, which is always exciting, and highlight some of our upcoming events. So without further ado, I will turn it over to Mike Dixon to deliver our invocation. Mike?
Great. Let's pray, everybody. Lord, we are grateful that you are a God who calls us friend, who came not to be served, but to serve. God, we ask that you might give us the courage to love in this same way. And today we lift up those who are most in need. We share the burdens of those among us who are struggling. Lord, we particularly lift up the friends and family of the USM student who was lost this last week, and those who were lost in the plane accident in town. Please bring peace and comfort to those who need it the most. And as always, Lord, help us to be the source of that comfort whenever we can. God, we also ask for your continued blessing on those who have so faithfully served us during this pandemic, on the doctors and nurses and hospital staff who have put their lives on hold so that we might experience life even in the midst of this pandemic. God, bless them, bless this gathering, bless our time together. And we ask all these things in your name. Amen.
Good morning. My name is Bryan Batson. Just two things for me real quickly. First, an introduction and then a request. As I said, my name is Bryan Batson. My wife and I moved to Hattiesburg 19 years ago. And we're just really impressed with this healthcare community and just the community in general. I first started practice here at Hattiesburg Clinic in internal medicine and pediatrics and then hypertension. Over the last few years, moved into more of an administrative role, about 50-50. And then in October, assumed the role of Chief Executive Officer behind Tommy Thornton. Tommy was exceptionally involved with ADP, serving on the board and the community for many years. I have big shoes to fill. and certainly welcome that challenge and appreciate all that he did to put this healthcare community where it is today. So, as I said, one of the things that brought us to this community was the great healthcare. My request is this: is that you recognize and think, as was just mentioned, that this healthcare community has been extremely stressed over the last 14 months, put through things that we never thought in our training that we would be seeing or dealing with. And so my request is really that you just take a step back, and we are not through this, but we are making great strides, which is amazing. But if you have somebody in your family, a friend, someone in your church, someone in your community, just over the next few days, especially this weekend over Mother's Day, if one of those people happens to be a mother who is balancing this along with motherhood, really reach out to them. I ask you, reach out, give them a hug, pat on the back, send them a text, send them a message, and let them know they're appreciated. This amazing healthcare community rose to the occasion over the last 14 months, and I've never been more proud to be a part of it. I believe next we'll be showing a short video, an excerpt of a video that we shared internally at Hattiesburg Clinic at the end of last year to show our appreciation for the amazing work that they've done during 2020. So my request is that you just use this as a thinking piece and reach out to someone you know who works in this great healthcare community we are a part of.
Good morning. This is Alan Anderson. I would like to announce our newest members. Renee Salon LLC, Bank First, Busby Companies, EV Mississippi, Inova Preparatory School, Mindset Fitness, R&J Construction, Realty Executives, Paula Brand, the Marino Law Group, and the University of Southern Mississippi Wesley Foundation. To learn more about our new members, please be sure to visit theadp.com to view their member listing, along with finding and following their social media and website pages. Discover what a membership in the ADP means to your business, or refer a new member by contacting Membership Director Ann Scott Mathis at a.mathis@theadp.com. Before moving forward, I have a couple of announcements. Membership appreciation. Our meeting will occur on Friday, July 23rd, 2021, 11:30 to 1, hopefully in person at the Southern Oaks House and Gardens. Our speaker will be Southern Miss head football coach Will Hall. Save the date also for our corporate golf challenge. The ADP corporate golf challenge will be Thursday, October 14th, 2021. We'll have 2 flights, one at 8 in the morning and one at noon. And that'll be at Timberton Golf Club. Corporate teams and sponsorships will be available soon at the adp.com. And now we will have Millie Swan, Vice President of Forrest Health, to provide our sponsor remarks.
Thank you so much, Alan. Forrest General is very proud to be a sponsor for the program today. Since 1952, Forrest General Hospital has been a leader in medical excellence in South Mississippi. We have actually grown from an original 90-bed facility to a 547-bed level 2 regional trauma center and hospital system. And in addition to the hospital's medical surgical facility, the hospital also includes Pine Grove Behavioral Health and Addiction Services, the Orthopedic Institute, Asbury Hospice House, and Forrest General's Cancer Center. Our specialty areas of service include behavioral health and addiction, cancer, emergency and trauma, heart and vascular, orthopedics and neurosurgery, surgery, and women and children's. In 2012, we actually formed Forrest Health System, which in addition to Forrest General Hospital includes Highland Community Hospital in Picayune, Jeff Davis Community Hospital and Extended Care Facility in Prentice, Marion General Hospital in Columbia, Pearl River County Hospital and Nursing Home in Poplarville, and Walthall General Hospital in Tylertown. Forrest General actually provides care to a 19-county service area, and we want to do our best to be the healthcare partner that you depend on. And as we move into our discussion today about the COVID pandemic, I do want to take just a moment to say a big thank you to all the Forrest Health staff, our physicians, and our patients and our families. Thank you so much for your perseverance and your patience through a very difficult year as we worked very hard to carry out our mission of do what is best for the patient. This Wednesday, we kicked off Nurses Week, which will be followed by Hospital Week next week. So we really want to salute our staff as we celebrate them these 2 weeks and also every day. So thank you so much. And now I think we are ready to introduce our panel today. Dr. Bryan Batson, who you heard from earlier with the Hattiesburg Clinic, Dr. Steve Farrell, Forrest General Hospital, and Dr. Rambod Rouhbakhsh with Hattiesburg Clinic. Thank you all so much for joining us today. I'm excited to get the discussion underway. And at first, I'd like to just take a moment to allow each of you a minute or two to introduce yourselves and your role in our region's healthcare industry. So, Dr. Farrell, why don't we begin with you?
Thanks, Millie. Steve Farrell, I'm an internal medicine physician by training. I've been with Hattiesburg Clinic since 1996. I'm starting my 26th year here in Hattiesburg. And for the last 12 years have served in the capacity as Chief Medical Officer at Forrest General Hospital, as well as serving on the Board of Directors at Hattiesburg Clinic as the Chairman of the Department of Medicine.
Okay, Dr. Batson?
Hi, good morning again. As I said earlier, been in Hattiesburg for 19 years, trained undergrad at LSU, then came back to Mississippi for medical school and residency. My residency was in a combined program of internal medicine and pediatrics. Then went on to do specialty training in hypertension, which is where my clinical practice focused for the majority of the last 19 years. And then over the last 10 years have moved into administrative roles, first serving as Chief Medical Informatics Officer for Hattiesburg Clinic, and then also as Medical Director of Accountable Care Organizations and Value-Based Care and Quality Management, and then moved into the CEO role this past October.
All right. Thank you very much, Dr. Rouhbakhsh.
Thanks very much, Millie. I realize now that my journey has been a good bit more peripatetic than my colleagues. I am also a Hattiesburg Clinic doctor, and I run the Forrest General Hospital Family Medicine residency. But my background is really far flung. I grew up in Oregon, went to medical school at Oregon Health and Sciences, and did family medicine residency at the University of Washington. Soon thereafter, I came to Mississippi, initially in Laurel, then been in Hattiesburg now for 5 years. I did a second residency at the University of Pennsylvania in preventive and occupational medicine. And currently I am situated in the clinical research facility for the Hattiesburg Clinic, where we are hopefully going to do more vaccine trials and more therapeutics.
All right. Well, thank you. It's such a distinguished panel for sure, and experts in your field. So thank you so much for joining us today. All right, to get things started, obviously, as we all have noted, 2020 was really a crazy year, to say the least, and healthcare leaders like yourselves just have done an incredible job on the front lines. Can't say enough about that during the pandemic. Dr. Farrell, can you talk about what this experience has been like for you, and also what it's like now as we see numbers trending in a more positive direction?
I think I never expected to live through a pandemic, read about them, and now have experienced one firsthand. So to say it was challenging would be an understatement. I'm amazed at the fact that it's been over a year now. And when I look back over the last year and think about what we have done in this community together, what amazes me now looking back is what we did together between every health resource in the community that came together and started meeting daily in the very beginnings in February and March of last year in order to address the coming pandemic and then to live through it. I think we were very responsive, and it posed a lot of challenges to us that we met. Now, as it appears to be waning here, hopefully with fingers crossed as I say that and knock on some wood, I think it's there's a little bit of relief in the air and still some trepidation hovering about where we see other places that there are second and third waves coming through, and we worry. Is it, are we facing a release or of efforts to protect us too soon, or are we doing it correctly? So the biggest challenge, I think, has been how fast the changes in science have approached us. Those of us in medicine are accustomed to reading articles and journals on a daily or even weekly basis, but none of us have processed the amount of information that we have had in the last year as rapidly. That changes literally day to day. And that's been a phenomenal thing for the world of science and medicine. As we look forward this year, I think there's a little bit, I feel like there's a huge weight off of our shoulders. I think there's some big challenges ahead to make decisions appropriately that still affect how we protect ourselves, our patients, our community, and give them the best opportunity to protect themselves from this virus while moving forward, and getting back to life as normal.
And with that, of course, Dr. Batson, the vaccines are now more readily available. And, can you kind of talk about, how the vaccines work, and maybe then common questions that people may have, possibly like side effects, how long these vaccines last, who should consider getting those vaccines? Can you address that?
Sure. Hopefully we're speaking to a group that has all been vaccinated, so this will be old news to them. That would be a nice thing. But to answer your question, we currently in the United States have 3 vaccines available: Pfizer, Moderna, and Johnson & Johnson. They are all basically teaching our body, training our body how to fight COVID-19, but they do it in a slightly different fashion. The first 2 that were available, Pfizer and Moderna, were what were called mRNA vaccines, a new type of vaccine, not new in study, been studied for a long time, but certainly new to the availability of being able to administer it. They again teach the body how to fight it. The newest option available in the United States, Johnson & Johnson, works is slightly different in more of a traditional fashion of vaccines, where an adenovirus is an inactivated adenovirus trains our body how to react and fight against COVID-19. So all 3 vaccines have been proven to be exceptionally effective, and I want to encourage people to continue to get them. The main side effects, to your next question, the main side effects are generally some arm soreness, maybe even a little redness, headache, fatigue, mild body aches, even some maybe GI symptoms. The good news is most of those side effects usually only last about 24 hours, 36 hours, and not everyone has them. It's been an interesting thing, having seen so many thousands of people receive the vaccine. The side effects are quite varied in everybody, but those are the majority of them. They typically only last about 24, 36 hours and then go away very quickly. To the last question, how long does it last, or next to last, is we know that it's at least 6 months. The studies show that we have very good protection for at least 6 months. We believe that it's longer, but honestly, Millie, that is a little bit hard to predict, because the vaccines continue to be effective against the strains that we are currently fighting. However, there is some unpredictability in that new strains are emerging and becoming more prevalent, and we can't predict how effective the vaccines would be against those new strains. Lastly, who should be vaccinated? Currently, everyone 16 and over may be vaccinated. We are anticipating some news in the next week or so that patients, children, adolescents between the ages of 12 and 15 should be able to be vaccinated very soon with the Pfizer vaccine.
Okay, thank you. And Dr. Rouhbakhsh, as Dr. Batson just noted, the different vaccines, can you talk about differences between them? Does it matter which vaccine? So many people say, should I get Pfizer? Should I get Moderna? And then we've heard a lot, of course, about the Johnson & Johnson regarding blood clots and things like that have been in the media lately. So can you address this?
Absolutely. Thank you, Dr. Batson, actually, for answering much of this question for me. Let me just kind of give broad picture. All 3 vaccines are indeed genetic vaccines. They all 3 carry genetic material, with the Pfizer and the Moderna carrying mRNA, whereas the Johnson & Johnson, and similar to the AstraZeneca that's being used in Europe, carry DNA in an adenovirus vector. The main differences have to do with the recommendations in regards to age, whereas the Pfizer can go down to 16, Moderna and Johnson & Johnson 18, and the differences in dosing. The Johnson & Johnson, of course, is a 1 dose, whereas the Pfizer and Moderna both require 2 doses, Pfizer 21 days apart, Moderna 28 days apart. I think what you're really getting at is, which one should I get if I have the choice? Well, the short answer is get whatever's available. There is ample evidence that they all work. There's ample evidence that they're all safe. And you're likely going to have higher access to Johnson & Johnson depending on where you live. So if I'm talking to the entire nation, the Johnson & Johnson is a more stable vaccine, meaning it doesn't have to be transported in ultra cold refrigeration. It lasts a bit longer once you mix it. So it will likely be more readily available in small physician offices, in pharmacies. We are very fortunate here in Hattiesburg to have a uber sophisticated medical system, especially for the size of community that we have with Forrest General and Hattiesburg Clinic. So we got Pfizer, we got Moderna. And if you're going to choose between the two, it's really kind of tomato between Pfizer and Moderna. They're almost exactly identical in terms of efficacy, side effect profile, which is good news because they're very similar type vaccines. And I would not hesitate to get to Johnson & Johnson. It is a big benefit to have only 1 shot and get virtually 80 some odd percent, or 72% actually efficacy, 86% against severe disease. And that's great, especially if you have to travel and you got places you want to go and people you want to see, and you want to be ready to go after 1 shot. So I would not hesitate to get that. It is worth noting that when the pause was put out for the Johnson & Johnson vaccine, that was due to 6 cases of a very rare outcome, what we call thrombosis and thrombocytopenia. Thrombosis referring to blood clots, and thrombocytopenia referring to low platelets. That was 6 cases in the United States after 6.8 million doses, so less than 1 in a million. And it is worth noting, if you're considering not getting vaccines overall, you really only have 2 options. You will get this disease if you encounter any humans whatsoever. There's no escaping getting coronavirus. You will get this illness unless you're vaccinated. So there's only 2 pathways which you can take. And if you analyze it based on those 2 pathways, well, if you get the infection, you could be lucky and be asymptomatic and go about your business. You could be fairly unlucky and have a severe 2-week illness. You can be super unlucky and have an ICU stay and potentially a death. You have none of those consequences associated with obtaining antibodies from the vaccine side. So from a scientific standpoint, it's pretty cut and dry. You should really take advantage of the fact that the United States of America invested very heavily to get these vaccines available, have them available for free for anyone that wants to take them. And I would highly advocate you utilizing that resource.
Great. Great advice. Get the vaccine. Well, Dr. Farrell, turning back to you, as you alluded to earlier, none of us saw this coming and we could not have imagined what 2020 brought our way. But with that said, another thing has been wearing a mask. And people have the question, do we continue wearing the mask? Is that important, even if we've been vaccinated? So can you answer that question for us?
I can try. So do we wear a mask? As a healthcare provider and a rule follower, I follow the rules as they are suggested by the science and by the bodies who oversee the science while they make those recommendations. I think very shortly what we're going to see in a large part of the world, when there's been ample opportunity for everyone to be vaccinated who is going to be vaccinated, that not wearing a mask will become an option. I think very shortly we may see in the public eye that people want to stop wearing masks and are going to stop wearing masks. As someone who is vaccinated, I am less concerned about wearing a mask to protect myself, but I still believe the science is out there that there may be a chance that I could be infected and carrying the virus, and I could spread that virus. So until I feel people have had adequate opportunities to protect themselves by getting a vaccine, because not everybody's, until recently, not everyone has had the same opportunity to get a vaccine. I think wearing the mask is the best option until we're advised against it by the CDC. And I think the CDC will issue guidelines that are conservative. I think right now being conservative is somewhat appropriate. I think very shortly the world will almost demand that we stop wearing masks. And I hope before that demand hits us that everyone will have availed themselves of the vaccine, as Dr. Rouhbakhsh said, which is, if it's available, go get it. So for now, I wear a mask when I go out. I wear a mask at work, not in my office. I'm here by myself and I have an air purifier on. So the door is closed. But, I think wearing the mask right now gives us the best option to continue to protect everyone until the virus has had a chance to be suppressed. We've got a large number of vaccinated people out there.
Totally agree. I know they're frustrating. We almost feel lost without them now, though. They've just become a part of our wardrobe. So
yeah, you can see mine on my desk right here.
That's right. We've got boxes, plenty of
So.
boxes around of those masks. So thank you for that. Well, Dr. Batson, kind of shifting back to the vaccine, the flu vaccine has become really a part of our lives and our culture. So I guess the question would be, do you see COVID vaccines, like a yearly vaccine like the flu shot, or do you see a booster, vaccine in the future?
It's a little bit of a crystal ball. We certainly know that the studies are ongoing. There are current clinical trials investigating both of those things to have availability for boosters if there is a need for boosters. Most scientists would suggest that we will probably need a booster. Now, whether that's one booster or yearly, a lot of that, again, depends on what happens with variants, what happens around the world, and does this become a yearly virus that we deal with after we get through this significant pandemic. I certainly, in looking in that crystal ball, it would suggest that we will probably need a booster 6-12 months from original doses. That is where things are pointing at this time. And we'll learn more. As Dr. Farrell said very, very well, every day we're learning more and have learned new things every day for the last 14 months about this rapidly changing information. But signs point toward additional vaccines being needed at this point.
Okay, thank you. Well, I think that we've all mentioned in one way or another how blessed we are to live in a community with such, strong healthcare. I mean, it's really, truly amazing. And I think we take that for granted sometimes, but we truly are blessed. So as we saw the video saying thank you, as I alluded to earlier, Nurses Week, Hospital Week, hats off to all of our staff. Dr. Farrell and Dr. Batson, can you kind of take a moment to talk about the stresses that you observed on healthcare workers over the past year? And Dr. Farrell, we can start with you.
I think the enormous stresses, a change in work patterns, in the manner in which people come to work, and how they have to suit up in the PPE, and as well as seeing people who were in very terrible clinical situations, and just the stress of, am I going to carry something home to my family? Am I doing everything correct? I am amazed at the resiliency of our staff and our healthcare workers in Hattiesburg, at the hospital and in the community. I think they have weathered the storm enormously well. And despite weathering it, I think they're also very fatigued. So I think there'll be a nice big sigh of relief when we can maybe not wear a mask in the hall of the hospital, except to go take care of a patient, and maybe not wear a mask to the grocery store, and maybe not have to worry about, the influx of a large number of patients we can't do a lot to treat. So I think that will be a big weight off people's shoulders.
Okay. Dr. Batson.
I agree everything with what Dr. Farrell said. It was a unique time in people go into healthcare to help people. And certainly that has been a guiding light throughout the last 14 months. But the challenges have been things that we didn't train knowing how to do, and the uncertainty of every day, not knowing what we were fighting. And I think as much of the stress, it wasn't about the hours being worked. It certainly contributed, the hours being worked, but these things that we didn't understand and we didn't know. And just the burden of the sadness and how scary things were over the last 14 months, and certainly improving. I will say, as I look at where we are now, there's some new stressors as we try to say, okay, what is the new norm of providing healthcare in this community and around the world? The new norm is different, and recognizing that we are still recovering from some of that trauma of the last 14 months, and recognizing that unfortunately we have lost healthcare providers. I mean, there have been healthcare providers who've succumbed to this disease, and then many have chosen to get out of healthcare because of the last 14 months, the stressors and the burnout of the last 14 months. So the new stressors that we're dealing with just as a general healthcare industry is that we're charged with continuing to healthcare, but now we're doing it with a smaller workforce than we had 14 months ago because of some very tragic events, and also people making choices to get out of this line of work.
Right. Well, we definitely saw that on our healthcare workers, and they were dealing with their own family situations. Many of them lost family members. Quite hard to navigate, but I know I was so impressed with the creativity though that came out of our employees. I mean, they really stepped up and got creative and adapted. So again, we definitely salute them. And Dr. Rouhbakhsh, as we kind of look to pivot back to hopefully the more normal in the future, what would you say that we could expect going forward?
Well, I think what we have to learn from this is we are likely going to see another zoonotic, meaning an animal-derived illness, probably a decade from now. This is the pattern in which we're going. And it would behoove us to understand why that came about and what we could do to mitigate that. So I don't think we will ever really be post-pandemic in the way that we were prior to this. All of us have become at least amateur epidemiologists and infectious disease experts, and I think to some degree immunologists. So we now have a higher vocabulary and a literacy for this, which I think will help us understand that the more humans there are on this planet, the more we interact with the animals, the more likely we are to have similar things. So going forward, amongst the things that we can learn is to be prepared for this, similar to the way we prepare for other national defense type things. And really, this has to be kind of an international defense where we will never again be caught without enough masks or personal protective equipment or resources for testing. These are all things that we had to struggle with about 14 months ago, which seems really difficult to think about now, but those are real concerns. Like, where do we get enough Q-tips to put in people's noses to then stick inside of a vial to send to a lab? So I think going forward, it would behoove us to remember these things and not forget them, because it will likely be another outcome 10 years from now. The other thing to comment upon is we did actually do really well once we hunkered down and decided we were going to do something about this. We got a remarkable piece of information about the efficacy of masks, which is really excellent news. And if you recall, back in March and February of last year, that was a point of controversy. And now we know that whenever we go forward in regards to these respiratory infectious diseases, we're not going to have that debate. And we're going to put the masks on and then do the studies later, so to speak. So I think going forward, we should probably all remember that respiratory virus season is going to happen again in the fall and the winter, and it's not going to harm us to put on a mask when we're out in public. And I think that's maybe the biggest thing to take away from this is the respiratory illnesses are really effectively shielded by the masks. And CDC actually had a phenomenal case report that I think it's worth mentioning, if you guys will bear with me for just one quick minute. In the summer, they looked at a number of infections that came from a source, which was a fitness instructor in Hawaii. And this fitness instructor taught 2 classes on the day that people were infected. This was before this fitness instructor had symptoms. He taught one class that was a yoga class in which he was masked, but the participants were not in that class, and 0 people in that class got COVID from him. He taught another class where he was unmasked and the others in the class were unmasked, and all 22 people in that class got COVID from him. So that is a remarkable infectivity rate where just one person wearing a mask shields everyone else from getting this illness. And so if I had one thing to say, we're never really going to be post-pandemic. We're always going to be in a state of pre-pandemic until we decide as a community what we want to do to prepare for this in the future. This should be a topic of conversation that we continue to have year after year. But in the very short term, if you get vaccinated, you have some really good news ahead of you. You can congregate outdoors with really no fear whatsoever of getting this illness. You can congregate indoors with other vaccinated persons with very low risk of getting this illness. So we have some really good news in the immediate future for us. And I would just ask us to keep our pre-pandemic preparedness thoughts going forward for the next one coming up in probably 10 years.
Well, as we kind of wrap up our discussion, but we're going to move into some question and answer time here in just a moment. Dr. Rouhbakhsh, on that note, there are a lot of organizations like the ADP, even our organizations, that are looking to move back to having hopefully in-person events, maybe later this summer. So with what you just stated, how can people begin approaching that? You know, organizations that need to conduct business and move forward and meet in person? Can you give a few tips for that as we transition?
That's a really excellent question, Millie. I'm happy you asked that. So there's really two ways, and we have made these transitions within our own program. One is to have everybody be vaccinated. And when you have a consensus of people that are vaccinated, you can congregate together without masks indoors. If you don't know the vaccine status of the people you're congregating with, you can be pretty safe outdoors. And so you can be maskless for the most part outdoors with reasonable distance between one another. Certainly not shoulder to shoulder at packed stadiums. That would not be safe. And then the third mechanism by which you can be safe is to wear a mask. I mean, your chances of getting this illness while wearing a mask are almost zero. So if you don't know, wear a mask.
Very good. So mask up Hattiesburg, still out there. All right, we'll stick with that. Well, we're going to, we've got a few questions that have come our way. So Dr. Batson, if you don't mind, I'm going to start with you. And this question is, there are reports of individuals who have gotten both doses of the vaccine, yet they contracted COVID-19. Could you explain why that is? And are the effects of COVID not as bad if you get the vaccine?
Great question, and one that we've in some ways almost been spoiled by the great efficacy of these two vaccines that first came out. Most vaccines, when they're tested and go through trials, they're considered to be effective if they get 50% protection. 60% protection is unheard of. So to have vaccines that are 95% protective was absolutely a home run. 95%, however, is not 100%. The other piece we know is that if one does become vaccinated or does get vaccinated and then does get COVID, it reduces significantly the chance of severe disease. And I think that was one highlight from Johnson & Johnson vaccine, is that it reduces hospitalization by 100%. So even those who are vaccinated, there is that chance of getting COVID, although it is, as Dr. Rouhbakhsh said, very, very, very small, less than 5% in the clinical trials. But some recent information came out that was in the clinical trials, 95% for Pfizer and Moderna roughly. But in practicality, as millions and millions and millions of people have gotten the vaccine, it appears that in practice, the efficacy is closer to 100%, 99.99, I think was the number. That's not 100% still. So it is still possible to get COVID, although those who are vaccinated who get COVID have a much milder disease.
Okay, thank you. Dr. Farrell, what long-term effects have you seen from COVID? Is there hope that those will eventually go away?
And I think I would probably have to defer some of that answer to Dr. Rouhbakhsh, who still practices clinical medicine. I've heard and you know, what some of the long-term effects that you read about and that people complain about, you know, with the fatigue and the ongoing muscle aches and some respiratory difficulties, you know, a lot of which is related to the systemic side effects of the virus and the infection in the body. I don't witness that. So I would ask Rambod if you wouldn't mind, you know, commenting on what you've seen.
Yeah, absolutely. So you're spot on, Dr. Farrell. There are consequences associated with this illness that have systemic consequences that we don't even quite yet understand. It's such a varied presentation. We now know that this virus actually gets into your brain. And so it has some neurologic effects along the lines of loss of taste and smell that linger for some people. These lingering symptoms can include a brain fog. They can include severe fatigue. And of course, some of the people that got this illness very early on, most notably the first NBA player that was diagnosed with this, Rudy Gobert, still can't smell. And we don't quite yet understand why that is. We do know that this illness, this infection causes blood clots for an unspecified reason. And sometimes those blood clots have manifestations such as stroke and kidney failure and heart attack. We also know that Very rarely, athletes can have a malfunctioning heart, what we call cardiomyopathy, and we don't quite yet understand why that is. So this kind of underscores our kind of binary choice. Your binary choice is get this illness and hope you're asymptomatic and hope that you get over it relatively easily, or you get the vaccine where you got maybe 24 to 36 hours worth of symptoms. I personally had none, and you go about your life. So this is still a very worrisome disease, one I don't want to get in any manifestation if I can help it. And I will piggyback on what Dr. Batson said in regards to the difference between real world and clinical trial. In the clinical trials, we are actively bringing people back and testing them, whether they have symptoms or not, in regards to whether they got this infection. And that's where that 5% reinfectivity rate comes from. But in the real world, the secondary illness post-vaccine is so mild that many of those people would never even come in and get tested. And that's why we're closer to 100%. So again, I don't mean to keep banging on this, but the vaccines work, they're safe, and the alternative is to get this infection, and this infection can have long-term consequences that we don't even yet know the end date on. So please get the vaccine.
And Dr. Rouhbakhsh, kind of on that note, this is a great question that someone submitted. In addition to the vaccine, what nutrients should we focus on to boost our body's immune system? I think that's a good question.
Yeah, this is a kind of a trite answer that I'm going to give, but this is what I tell patients: vitamin D and E. And what I mean by that is diet and exercise. So there are many manifestations of being healthy that come about from having a good diet and exercising regularly that we don't even have a close understanding of. But there's really good evidence that diet, meaning eating healthily, more towards a plant-based diet, less towards saturated fats, less towards simple carbohydrates, boosts your immune system, really makes you less likely to be obese, which we know is associated with bad outcomes. And then exercise has myriad benefits, including just actual boosting of your immune system. Should you happen to be outside, you do convert vitamin D, which we know has some protective effects, not so much in the supplementation. There's something about producing your own vitamin D from natural sunlight that is different than when we just take it in orally. So I would say, don't focus so much on getting herbs and spices. Focus on getting enough sleep, getting enough regular old water, check your diet, make sure you can clean it up as best you can. And if you haven't been walking 20, 30 minutes a day, this would be a great time in South Mississippi to get out and start doing that. There are myriad reasons why that's beneficial, including just being outdoors, where we have had studies that show that your immune system is actually boosted with the phytochemicals that are given off by plants and trees. And this is a whole field of study that is really interesting, and I think a burgeoning field, and COVID probably helped this to some degree as well, but we just don't know why it is, but we do know it helps. So get a good diet in, exercise, get plenty of sleep, and drink plenty of water. Don't worry about those other things.
Sounds like the healthy habits that we should all be doing anyway, right? For a healthy wellness and healthy lifestyle. So thank you for that. Well, I think we're about to wrap up, but Dr. Batson, I'm going to give you one more question that came in. How can the community support the healthcare system going forward?
No, and thanks for that question. That's really amazing. I will say that it doesn't take much. Like I said, a simple pat on the back, a hug, a text, that means more than anything. You know, I worked over at that cough and fever clinic for months on end, and simple little acknowledgments of, you know, thanks for helping keep our community safe. We are a part of an amazing medical community, and simple things. It doesn't have to be complicated. It doesn't have to be expensive. Little things go such a long way. And that is my ask, is that we continue to support these people who are supporting our community.
Yes, and we do want to thank the community because they have been so supportive. And like you said, just a note from people, people dropped off meals for our workers. So we can't thank you enough. And Awesome job, panel. Really enjoyed this, a great discussion, and thank you so much for joining us. And now I'm gonna toss it back over to Chad to wrap us up.
Sounds great, Millie. Guys, thanks so much. Millie, thank you for moderating today. You did a great job. Many thanks to Dr. Batson and Dr. Farrell and Dr. Rouhbakhsh. I just love this program. I mean, it is so, we are blessed immensely to live in a world-class healthcare oriented community. As Dr. Rouhbakhsh said earlier, for a metro area of our size, our healthcare is second to none. And plus, gosh, from an economic impact standpoint, we have over 9,000 healthcare employees, probably over $500 million a year in payroll. What an economic impact in addition to the fine healthcare that's provided. So again, thank you guys for that great advice. And I will say the Newells have been fully vaccinated. I got my second COVID vaccine, Pfizer vaccine last Friday. So I guess I'm in that window where I'm not maybe bulletproof yet, but I'm getting there. It's kind of interesting in our household, and there are similar households out there. We have 3 generations under roof. So, ranging from 16 to 78. And so we tried to be extra careful throughout this pandemic, and now everyone in my household's fully vaccinated. So I encourage everybody to get the vaccine for sure. And, it's kind of wild. The first 2 weeks in March of 2020, I was in DC, Atlanta, and Birmingham. And then it all came to a screeching halt, and I haven't been back on a plane traveling since. So in June, I'll be traveling on my first business trip to Florida. And so 15 months later, getting on a plane to go promote Greater Hattiesburg. So it's just been a wild ride. But again, we're all blessed that, we're on this panel today and we've maneuvered through this pandemic. But great advice that you guys offered. I do want to tell you, we're going to try to adhere to the healthcare professionals guidance. Our next large event is going to be an outdoor event. May 20th, we have our Forward Together Victory Celebration. And so for all of our partnership foundation investors, I encourage you, those of you who have invested in Forward Together, these funds are going to be used very wisely in helping the ADP implement a robust program of work in economic development and helping companies start, existing businesses expand, and then proactively recruiting new jobs and investment literally from around the world. So you should have received this invitation in the mail. If not, no worries. We're going to email the invitation out to our Forward Together investors on Monday. Please RSVP to receptionist@theadp.com. We need a good, accurate head count to be able to plan accordingly for the event on May 20th. Moving along, on Friday, July 23rd, this will be really our first large in-person event. It will be at Southern Oaks House and Gardens. Again, Friday, July 23rd, 11:30 to 1. All of our members of the ADP are welcome to join us for this luncheon. We're pumped to have Coach Will Hall, the new Southern Miss head football coach, deliver the keynote. So I encourage everyone to come out to Southern Oaks, wear your black and gold. It will be a great networking event. Pearl River Valley EPA and the First will be our sponsors. Also, we are already planning for our Fall Corporate Golf Challenge. It will be at Timberton on Thursday, October 14th. We always have 2 flights, 8 a.m. and 1 p.m. Many thanks to Hattiesburg Coca-Cola for, again, being one of the head sponsor. And they are going to do this through the Southern Miss School of Business this year. So Southern Miss College of Business and Economic Development will get some great exposure with the golf tournament. So the sign up for sponsors and for teams will be coming out very soon. So stay tuned for those details. The Navigator, the digital edition of the Navigator, the second quarter came out. I hope you guys have taken a gander. If not, go to theadp.com/publications. And this edition does highlight some of the Forward Together volunteers and the key leadership and some of those accomplishments. And it also talks about SimKick, our small business lending program. We've made 2 new loans just in the last few weeks. One is for a restaurateur in downtown Hattiesburg. Another is for a small business owner in downtown Summerall. So not only do we recruit big businesses and help big businesses grow and prosper, but we never forget about the mom and pop shops that make our community tick. So I know you'll want to take a look at the Navigator. That's all we got for you today, guys. Again, thanks for our frontline healthcare workers. They served tirelessly throughout the pandemic. We can't thank them enough for their sympathy and empathy for all the patients that they've seen and for their endurance. What a level of endurance that was needed to navigate through these treacherous times. Hope everybody enjoys this gorgeous spring weekend here in the Pine Belt, and we look forward to seeing you on July 23rd at our Membership Appreciation Luncheon. Take care.